A considerable number of people affected by jiggers deep in the villages of Bujiri and Kaliro districts take for granted their affliction. They have become so used to their pathetic situation and regard their infestation by jiggers as a mild problem that will eventually go away on its own. We interacted with Esther Namukasa, a resident of Kasokwe village in Kaliro district, to try and understand clearly why this state of resignation prevails.
We don't
consider jiggers a very serious problem. All we do is remove the jiggers and people get back to normal.
When jiggers are detected in people's feet, the usual thing that's done here is to ask a close relative to pluck them out, without giving a thought to getting help from medical officers, mainly because of the biting poverty that they live in. And this perhaps explains why medical workers at Bulida Health Center haven't registered cases of people infested with jiggers in a long time.
We hear that the jiggers are in the villages, but here we don't save patients here.
Tetufunanga keesi ezo lwakuba tebakitwalanga kikulu naye gye ziri mu byalo.
The situation is similar at the main district hospital in Bujiri town.
We have not admitted any. Even up to now, we don't have any currently.
The only recourse to the jigger menace is the assistance offered by relatives to pluck them out. However, this is only possible when there are willing relatives to help out. Among the elderly, however, this solution may not apply, since culturally, grown-up children, especially girls, are barred from coming into contact with their parents.
In our culture, once the girl matures, she becomes an in-law and she isn't supposed to touch her father.
Outbreaks of jiggers in Busoga are not new. Over generations, myths and superstitious beliefs have developed among the locals.
That is a problem. So some people are misled by some people who think that because we don't have a chabazinga, that is why we have a problem. For example, someone saying that there is an ant-hill, which is the headquarters or a source of the jiggers. Now that we are fighting this problem, we want to go and see where that ant-hill is, and we see where the real problem is.
However, the Bujiri LC5 chairman says attitudes are beginning to change and that people are now embracing modern medicine.
Originally, people were thought a lot about witchcraft, and we had many of these traditional doctors, these museum people who have also lost out. Now, as we talk, people at least try to go to health units, because even the health units, the numbers have improved.
A number of the elderly people affected by jiggers in the area are addicted to alcohol, which has greatly contributed to their poor hygiene.
I have two issues that affect me, jiggers and hunger. If only I could get someone to give me free food, I would really appreciate it.
This man, for instance, only takes a bath when his wife has fetched him water, highlighting the attitude of most men who take women as slaves who must do everything for them.
I want my wife to fetch me water for bathing because I bought her with a lot of cattle.
Although district leaders time and again stress the need to maintain hygiene in homes, the biting poverty that people find themselves in has bred apathy, drunkenness, and in certain cases, the belief in witchcraft, which makes it harder to push efforts to eradicate jiggers in the region. Chris Ochamringa, NTV.